cancers that seem local, regional, meaning contained in one area. Potentially maybe there's some lymph nodes that look suspicious on the CT scan, but no evidence of any spread to, let's say, the liver or the lungs, which would be more of a distant spread and denote a late stage, such as stage 4. So usually stage 1 to 3, we would go for surgery as the first option. And surgery is really your best chance of cure. Oftentimes the final stage is not known until the pathology comes back. Sometimes we would look at a colon cancer and say this looks relatively early stage, maybe this is a stage 1 or potentially a stage 2, and we may get the pathology back which shows that the cancer has maybe invaded deeper into the colon or maybe in the pericolorectal tissues, which are just outside of the colon, or has maybe spread to the lymph nodes. And if that's the case, then that changes what we're going to do after the surgical resection. As a general rule, with the different stages of colon cancer, typically stage 1, people just need a surgical resection, and that is generally curative. Stage 2, depending on your risk factors, you may need chemotherapy after the fact. Stage 3 tends to involve the lymph nodes, and we know from clinical trials that people that have lymph node involvement with colon cancer definitively benefit from chemotherapy. It decreases their risk of recurrence, it gives them a better overall survival, so those folks definitively need chemotherapy. And then stage 4 is spread outside of the colon, so it's a distant metastasis or spread somewhere else. Most oftentimes it's to the liver. Colon cancer is a little bit different cancer than some of the other solid tumor malignancies. When we look at other cancers such as, let's say, pancreatic cancer or cholangiocarcinoma, which is a cancer of the biliary tree, maybe even cancer that starts in the liver and then spreads somewhere else, hepatocellular carcinoma, or even lung cancer or breast cancer that tend to be stage 4, meaning distant metastases. Oftentimes these are very difficult to cure. Colon cancer is a little bit different in that when folks present with a single isolated metastasis or cancer to the liver from the colon, and there's no evidence of any spread anywhere else, we can still cure some of these stage 4 colon cancers with surgical resection or ablation of the liver metastasis in addition to the chemotherapy.